everyone, and welcome to the Dragons, Gazelles, and Unicorns podcast, where we explore the cutting edge of health, innovation, and leadership. I'm Rosemary Truman, the founder and CEO of the Center for Advancing Innovation and Ignite Social Impact. Today, we are absolutely thrilled to welcome a distinguished guest, Dr. Jean
Accius,
the newly appointed president and CEO of Creating Healthier Communities, or CHC. Dr. Accius brings a wealth of expertise in the realm of healthcare policy, community well-being, and the connection between art and technology. And he can talk more about that with his role on the board of Strathmore. He has a doctorate in public administration from American University and a career in spanning various leadership roles, including significant contributions to AARP. Dr. Accius has been a prominent voice in shaping healthcare policy and advocating for equitable health access, which we know is a tough topic to conquer. His expertise lies in addressing the needs of older adults, transforming healthcare systems, and fostering community engagement. Under his leadership, CHC is poised to innovate and expand its impact in creating healthier, more inclusive communities across the nation. Today, Jean joins us to share his insights on the future of healthcare and the role of technology and innovation in shaping health systems and empowering communities and individuals with his vision in CHC. So I'm extremely excited and about his providing some great insight and wisdom in this topic and willingness to be on the podcast and spend his time. So, Jean, could you provide or share your information with us about what initially drew you into the field of healthcare and community leadership?
I am really intrigued by this podcast and also the opportunity to really kind of have a conversation around how innovation and technology and health, particularly at the community level, are intertwined. And what does that actually mean in terms of the lived experience of the individual? For me, to answer your question, I can recall in my when I was a teenager, going with my aunt to our local health clinic and sitting in the waiting room to be seen. When I walked in, there were many other people before us, and the room was pretty crowded. This was a local clinic in our community that really serves the needs of individuals that might have limited resources. I recall waiting for quite some time to get services. And I remember how I felt that day. Not physically, but in terms of the experience of interacting with this particular health clinic and looking around the room and seeing how dimmed it looked and how people were not actually being seen, if you will, even though they were physically there. And if they were being seen, might not be valued in a way that would really speak to the person's sense of humanity and dignity. Fast forward, decades later, my daughter gets sick over the winter holiday break, and I take her to the emergency room in fact, in Silver Spring. And I remember walking into that facility. I remember walking into the emergency room and seeing a packed emergency room in the lobby. I mean, just there was no chairs for someone to sit in. And I remember looking at my daughter and saying, "Sweetie, how could we make this better?" And she had some ideas as a 10-year-old. I got into this because of the fact that health is the most fundamental aspect of our being. And in the absence of health, it really creates challenges in terms of being able to ascertain other ambitions or to accumulate wealth. I got into this because of the fact that whether it was my upbringing where I was in an environment where there were glaring disparities and inequities. And fast forward decades later to where I have a range of options and resources, but yet our system is still lacking in terms of being person-centered in its approach to delivering care, is why I got into this work. I also got into this work, Rosemary, because of the fact that so much of our health is outside of the healthcare system. It really depends on where you live. Your zip code is a stronger predictor of how long you will live in the United States than is your genetic code. So there are amazing opportunities for us to think about ways in which we can care for others, give back, engage the community in this broader effort of creating a more holistic environment where people can live healthier and more productive lives.
So I have a couple questions to follow on to that. The one is I'm curious about what your daughter said, but the but the and in addition to that, so I agree with you. Much healthcare is outside of the healthcare system. So I was wondering, we can save that one for the second question, but I am curious about what your daughter said, and then we can go into the.
Well, she said, one is the fact that she said, Dad, is there a way where we can basically, even within emergency room setting, is there a way where we can basically not have to wait in the lobby with so many people? As I mentioned, Rosemary, this was standing room only. And once you're in the emergency room, even in her particular case, you can't go sit in your car and wait to be called.
Mm-mm.
Now, in an environment where you have rapid viruses spreading, and you're in an emergency room where you actually saw a range of individuals that had different conditions. There was one patient that may have had a fall, and you saw the blood dripping down. I mean, it was all of that,
Yeah.
right? So one of the things she said was that, is there a way where we can check in and be able to go sit in the car and wait to be called?
Yeah, seems like it should be easy, right?
It should be easy. Or is there a way where we can at least do some of the pre-work to kind of move things along?
Yeah.
So those were some of the things she brought up.
Mm.
But it was this idea of not necessarily being in a room that's standing room only with people that have a range of different illnesses and challenges waiting to be seen.
Yeah, I had to. I was in DC for a basketball game, and I got assaulted in the lobby of the hotel when I got back. And so they had like detectives on the floor and everything else. And they said, I have to go to the emergency room. And when I got to the emergency room, I left because people were cuff-linked everywhere. There was a whole police mob there. It was scary to be there. So I can imagine, your daughter is probably seeing the same thing. Numerous conditions going on, but then also people who are violent, actually. I mean, that's why they cuff-linked them, and they had all this pack of, I don't know if it happens all the time this way, but it's a scary situation in the emergency room.
Right.
There should be ways to make that more accessible,
That's
not not segregated or anything like that, but just to make it more accessible for a person who could be shocked by, having, a cop have a gun pointed at a person because they may have a violent outbreak. So, but then they have them cuff-linked. So but I mean, that's what that particular emergency room. The other thing is, to your point about people don't see anyone. I feel that way all the time. Even when you go to a restaurant, people don't even ask the person's name,
name.
and they're serving you food. I mean, it's so often in our society that even you go to the grocery store, no one ever recognizes the person. They have a name tag on. You could say, hello, John, hello, whatever the name is. And you know, I do this crazy thing, and I bring these little cards that say thank you, and they have like little flowers on them. So that, and then when I get to the counter, I write a little note, and then I give them the little card, and you never wouldn't believe, it just, or I bring other things too. I bring socks.
Yeah.
Uh,
I think this idea of being seen is something that is critically important because it taps into the fabric and core of the individual. And what I mean by that is the fact that at our deepest core, we want to be seen. We want to know that we are valued and what we have to say actually matters. We're more than an insurance card. We're more than a condition, whatever that condition is. You are an individual with life experiences, and that should be taken into account in the form of care.
I think that's a highly insightful point, because what if the reverse happened, and well, even if, you know, we recognize the people with their name tags, but they actually say, hello, Jean, you know, how are you today? You know, I mean, something that could show that people actually recognize the people, you know, that are sitting there. Yeah, and I mean, I agree with you on the, like, so much time awaiting and waiting. But, so that's it. Very good. Thank you so much for that. And then is there, so do you think that was like, I think what you were mentioning was the moment that you were sitting in that waiting room when you were a child and with that huge group of people, and basically waited for probably hours waiting to be seen. That was what you started to think about, how the system could change generally.
That is exactly right. And not just how the system could actually change, but how could we better integrate our medical care with our broader social needs, and given the connectivity between the two. And that was an opportunity for me where I said, you know, this is where we have an opportunity to really think about our collective beings in a way that could ensure that whether you're at the federal qualified health care center, or you are predominantly private pay, that you are seen, that you are valued, that the person who's providing the care also understands your perspective and lived experience. And that when you are leaving, that there is a range of wraparound services to ensure that you're successful going back home. And I think being able to ensure that that system change happens where there is an integrated approach and different parts of the system, they're talking to each other, and that there's a care team that includes the family, whoever that family caregiver is critically important to ensuring that people are seen, that they're valued, and that their lived experience is honored.
So I think about it a little bit about like a supply chain, you know, so sometimes, you know, well, you usually don't know you're going to be ill. You go in, you're then waiting forever. And then, to your point, then you finally get seen. They don't, you know, perhaps there's, when I say seen, maybe you're not seen, but they, you know, they see you after sitting outside for 3 hours and then inside for an hour.
I used to work in DC, and I needed to go see a dermatologist, and I selected, based off my insurance carrier, a provider that was near my job, so it was pretty convenient. I could just go there and come right back to work. And I remember going to go see this dermatologist. And when he saw me,
Yeah.
he would say something. He would use some medical terminology that I didn't understand. And after each sentence, he would say, I hate to oversimplify this. So he would say something using medical terminology that I did not understand. And after each sentence, he would say, I hate to oversimplify this.
Yeah.
So A is the language. So it was the language that was being utilized. But
Yeah.
then it was the I hate to oversimplify this. So somehow, as a patient, I should have understood what you
Right.
just said. And clearly, you said it in layman terms, and I am not smart enough to grasp it. So you are oversimplifying what you just said. You understand what I mean? So I
Yeah.
remember leaving that encounter, not feeling seen, not feeling heard. And I remember calling my wife and she said, so how did your dermatologist appointment go? And I said, I have no idea. She said, what do you mean you have no idea? I said, the guy kept on saying things. And after each sentence, he would say, I hate to oversimplify. So I felt dumb asking any follow-up questions because apparently whatever he said, I should have grasped.
The dermatologist said, you just have to pray to God. There's no hope for you. Is that oversimplify or what? No hope for you. You're gonna grow. So, oh my gosh. I guess you got like both sides because I said why,
Yeah,
and he said he didn't want to know. So I mean, I don't. In any case, that is
yeah.
neither here nor there. But I think this there's two flips of the coin there. On how
That's
to help.
exactly right.
Yeah, because sometimes it won't tell you anything.
Yeah.
Um, um, so one thing that I was wondering about, oh, I've been taking lots of notes here. Um, let's see. So I was curious about if you had any kind of mentors also that put you onto this path.
Yeah. So I am very fortunate. I call myself being a benefactor of a village of mentors and also sponsors, and have been fortunate enough to have a kitchen cabinet of advisors that has put me on this path. And what I mean by that is the fact that the ability to literally put yourself in someone else's shoes is something that has been part of my core DNA. I was raised by my grandmother for the first 4 years of my life in Haiti. I saw firsthand the amount of sacrifice that she had to make to ensure that I had the resources and the things that I needed to thrive at that particular age in life stage in my life. And that included her waking up very early in the morning before the sunrise to go into the marketplace to sell products and then coming back real late in the evening after a long day of selling products so that she could ensure that I had food to eat. And she, in her own way, has been a mentor to me because I learned and saw firsthand grit. I saw firsthand determination. I saw firsthand hard work and ethics. So when people say you got to have grit, you have to be determined. You can't be discouraged by your conditions. I saw that each and every day, Rosemary. And my grandmother would tell me to be strong, that you are good enough, that you got to go out there and make an impact that's bigger than yourself. And I am extremely blessed that she is 100 years old. She's
Oh,
still with us. She has dementia, but even in that state of having dementia, she is still strong. I saw her most recently did the break, and she was as strong and strong-willed as one can be. And I say that with a tremendous amount of smile and uh, gratitude. In addition to my grandmother, I've been extremely fortunate to have teachers, whether it's actual teachers in the school setting or teachers of life, who would pull me aside and say, you know what, I see something in you. Let me give you some advice.
Nice.
So I've been extremely grateful in that sense. In the work setting, I've also been very grateful and very blessed to have leaders who took me under their wings, and I was able to learn from them. And that has been a gift for me because I can pick up the phone and let my guard down and say, "This is what I'm experiencing." And these are leaders of all stages in life, all of all ages and life stages. These are leaders of all ages and life stages, Rosemary. Because I also think that you can learn from those who are much younger than you, as well as learn from those who have gone before you. So I've been extremely blessed. I've been extremely blessed by the village of mentors that I've been able to be in the presence of, and to be able to glean their wisdom, their insights, their support, their tough love, and also have done the best that I can and will continue to do so to pay that forward.
Wonderful. It's a, there's a lot to unpack there. I feel the same with my board of directors, for example. Nick D'Onofrio, I've known him for 26 years. He was #2 at IBM for 45 years.
Wow.
He's the chairman of my board. He's on the board of like MITRE and Liberty Mutual and all these other places. And the nice thing is I can text him and he'll text me back and say, "Can I call you in 10 minutes or an hour," or something like that. And with crazy questions, that I have that they're, well, I think they're crazy, but the thing is sometimes you want to have another voice,
Right.
some other guidance.
Mm-hmm.
Then I have a question also that leads into this because, well, I have several questions in this paragraph, but I think a lot of people find it very difficult to build that village. And some of it is natural and organic, but some of it is you have to actually, introduce yourself to people that you don't know.
Mm-hmm.
So did you do it? So I always say tops down, bottoms up.
Mm-hmm.
So tops down is you say, these are 3 people that I really want to know. And then you go introduce yourself to them. Mm-hmm. And you're persistent and tenacious. Right. So that strategically was how I got into Goldman Sachs. I mean, I was told 145 times no by Goldman Sachs when I was 19, because I wanted to go to Goldman Sachs. I wanted to be on the listed stock block desk, and they said 145 times no. So I had to figure out a way around and identify the person who would be the right person. But I mean, that's but then you're saying, okay, well, I don't know who that person is, but I'm going to write a proposal for them, so to speak. Or this one guy, his name's Bruno Fonzi. He's a great guy. One of the guys who runs Codemy, which is a combination of art and tech, and he runs it with another gentleman. But he's head of Salesforce engineer. He's head of engineering for Salesforce. So the thing is, it was kind of a cold call. And these are sometimes cold calls when you're doing strategic. So I found out, I did research on him, and because I wanted to do a partnership with Codemy, and I found out that he likes chocolate coffee. And so in the subject line that I wrote to him, so I found his email, I said chocolate coffee. And put a few sentences there. But so that's the tops down way of doing it. And then there's the bottoms up, where you are just fortunate that you meet really good people and they like you, they like you, like the teachers you were mentioning. And so what was your strategy in kind of building the village? I mean, there's another way, which is benchmarking. But the tops down, bottoms up, and the benchmarking, the sideways, is another way, which is looking at peer groups that are interesting. And one of my other friends, his name's Pete Thurlow. He is the head partner. He grew up out of 11 kids. Head partner at one of the head partners. Sorry, he's the at Pazinelli,
Okay.
And so, you know, he went to, I'm just giving this as an example, but I thought it was fascinating. He decided he wanted to go to law school, and then he walked into a professor's office and he said, I really want to make an impact. I want to know how to do it. And he was advised to go to this association. And when he went to the association, they made him like the treasurer or something along those lines. But he met all these people. So I would call that like the kind of sideways part, because it wasn't tops down. It wasn't like bottoms up. It was the association. So what was the way of your building the village?
It was a combination of all the above that you just mentioned. I think the key thing is to understand the sense of why. Why do you need a village? Or why do you need mentors? And what type of mentor do you need, and at what stage in terms of where you are? And for me, I went about it from really being one, curious to learn, so always biased to learn. This idea of continual growing, continual learning is critically important as a leader. And I always, even at a young age, Rosemary, always gravitated, frankly, towards older people because of the fact that I wanted to know what their living history was. These were individuals who've had decades of experience, and I wanted to just kind of really sit at their feet and understand exactly, given where you are. And we know Maslow's hierarchy of needs is that, the at some point it's self-actualization. So oftentimes when you meet older adults, they're at that stage, and you hear it often where they say, I'm at that stage of my life that I don't care about hurting someone's feelings. I'm gonna tell you exactly how it is. I'm gonna tell you, there's no filter. I mean, you kind of hear that there's no filter. But at the same time, they have a lot to share. So for me was the fact that it was an opportunity to be the benefactor of their wisdom, and also to understand exactly what were some of the things that you wish you could have potentially done differently. How can I learn from you? I remember when I had this very tough assignment for work in a prior role, and I called one of my mentors and I was complaining. I said, how did I get selected to do this and this and this and this? And I was only looking at the potential challenges with executing on this assignment. And this person listened to me. She didn't interject. And then she said, well, here's another way for you to look at this particular issue. Have you thought about this? And up
Mm,
to then, I never had.
mm,
And once it was like a paradigm shift.
mm,
Once that happened, I went into work that following week, renewed, recharged, and focused.
mm-hmm.
The week that it was a Friday when I got the assignment, I felt discouraged, deflated. I went into work that Monday feeling empowered. That
Mm,
is what a mentor can do for you. So I think it's a combination of starting with an understanding of yourself in terms of exactly why do I need and want a mentor? Because I think it's critically important that if you're going to be looking for mentorship, that you have to ensure that you are being A, respectful of the person's time, B, that you're demonstrating a return of their investment in you. And I'm not talking about monetary. I'm referring to the fact that whatever insights that they share, that they're actually seeing some action and some outcome as a result of the mentor-mentee relationship,
mm,
and that you're growing along the way. So
mm,
it is bottom up, it is top down, and it is horizontal.
mm.
And I think the other aspect of this too is understanding that you'll likely need different people at different life stages of your life. And I think there's a difference between having mentors and then also having a kitchen cabinet of advisors.
Mhm. Mm. So, how do you deal with um, situations where I'm sure this has happened to you? You are you have a person who is quite influential, who could potentially provide you value, but but really what they seek is a more value from you than
Mhm.
they want to give in return.
Mhm.
Does that question make sense?
So this relationship is more transactional in nature.
Yeah, essentially, but you know, it's they're potentially influential people,
Hmm.
but they really want to engage with you when they want something from you. Have you had that situation?
So we live in the DC area, and I don't want to overgeneralize, but the ability to, so the interaction of someone engaging with you when they want something is something that might be more prevalent in certain geographic areas. First of all, it's human nature. It's probably prevalent more. So I'm joking for those who are listening from the DC area, but I remember coming to DC when I first moved to DC from Florida, and I was struck by the culture in the DC area that oftentimes people might say it would be the gist of the conversation would start off like this. Oh, what's your name? And you'll say, my name is Jean, or my name is Rosemary. Then the second question is, so what do you do?
Right. That happens all the time. That's 100%.
And depending on your response, dictated the level of engagement thereafter.
And they're gonna go this way or they're gonna go that way. Oh, I need a drink right now. Do you need a drink?
Right? So, so that's why I kind of chuckled in terms of the geographic location, because I was struck by that. I was like, and the boldness was, what do you do? And depending on what you said, they asked, so I'm sorry, I didn't catch your name. So it depended on the person, but it was it was either the first or second question. But I think in that particular case is again assessing the nature of the relationship and what can you learn. I often believe, and I know we're talking about innovation and we're talking about health and we're talking about community health. I often believe that you can learn a lot by people's failures as much as you can by their successes. And oftentimes we live in a society that actually celebrates and glorifies success. But as you know, Rosemary, in the space of innovation, there are so many failures
Yes.
before you get that product, that service, that offering that really disrupts the marketplace.
Hmm?
And one of the things that we've done here at CHC when I came on board was actually as part of our organizational values, as part of our strategic plan, is create a culture of learning and innovation. And I'm extremely excited because of the fact that as part of that strategy is that we actually have created an innovation committee of staff at all levels within the organization to help us drive innovation throughout the entire organization at CHC. What do we mean by innovation? What do we mean by bringing in new and different ideas and being able to test things and before they go to market? How do we continue to evolve to ensure that we're relevant and that we're actually meeting the needs of our communities and meeting the needs of our nonprofit partners and meeting the needs of the people that we serve? That requires a sense of innovation. So I say that to say that we live in a society that glorifies success when in actuality it is a series of failures that gives you probably some of the most impactful lessons and learnings. So for those individuals that you might encounter where it's transactional or they might want something more from you, that's a learning as that you can glean as a leader as you continue to make an impact and influence in the space that you've been influencing and impacting.
Here's you. Oh my gosh, I have like so many questions for you. The so since you have had your village and you've cultivated partners, lots of partners, and you've been working on creating this culture about um, you know, the innovation community, and also evolution, but driving evolution and trailblazing, I would say, if I may so say so. What how do you see the upcoming initiatives and projects at CHC that you're particularly excited about, where you are kind of engaging with your partners, engaging with the community, and so on and so forth? So I know it's a very long question, but
No. I will tell you that, for me, the vision at CAC is really one around impact. How do we ensure that every person in every community has the opportunity to live their healthiest life? How do we bridge and integrate technology and innovation in an environment that's consistently changing rapidly to meet the needs of individuals? And for nearly 70 years, we have been on this journey. We've raised over $1 billion today to support more than 5,000 nonprofit partners across the country. We're on multiple communities. We're helping businesses that represent millions of individuals in terms of engagements and really trying to address the needs that our society faces. It's a urgency on our end. We see this as a moral, social, and economic imperative to close so many of the gaps that exist. And the only way we can actually do that is through partnerships. No one organization, no one sector can solve the challenges that face our communities as relates to their collective health alone. It takes a village, going back to our earlier point. For me, I'm extremely excited because as I come on my 1 year anniversary as the CEO here at CHC, we've been able to accomplish many, many things. One is the fact that we've actually launched and executed a 5 year strategic plan for the organization that is going to put us on the path to really accelerate our impact and to drive innovative solutions to meet the needs of our nonprofit partners, the communities that we serve, in a way that actually closes many of the gaps that I talked about earlier. In addition to that, we have facilitated and brought in some amazing partners on the world stage. CHC has partnered with the World Economic Forum, our Global Health Equity Network. So we're one of 100 organizations that are committed and driving towards creating a more healthier and more equitable society, working with business, working with nonprofits, working with government in order to do so. The work that we've been doing with our maternal health work is groundbreaking and have now partnered with the Clinton Global Initiative to actually bring some of that work to scale. We are celebrating the births of some of our program participants who have gone through our Black Birthing Initiative. We had 6 births in December, and we have an additional 25 births that we're going to see by the end of this month alone. So we are literally making significant progress to really close many of the gaps in a way that drives and ensure that people have the gift of time.
So congratulations.
Thank you very much. Thank you.
I'm more than, I want to jump up and down.
We had started this initiative 3 years ago with funding from the Elevance Foundation, and it was designed to address the maternal health crisis in the United States,
Oh, wow.
particularly in Black and Brown communities that oftentimes see 3 to 5 times negative outcomes due to a range of factors, whether it's weathering or systemic inequities and a range of challenges that they face, with the hope that we can close some of these gaps. And part of the Black Birthing Initiative was designed to really take a very holistic systems approach to this work.
It's a very big problem.
Which is a huge problem.
Yeah.
And because of the work that the team has done with our partners, we've been able to provide doula services. We've been able to help families learn how to advocate for themselves and to really think about how we coordinate that care to ensure that no one is falling through the cracks.
Yep.
And as you can imagine, this is hard work, but it's also hard work. And one of the stories we heard, particularly from one of the first participants who went through the Black Birthing Initiative program, was that when it was time for her to give birth, the hospital tried to encourage her very strongly to have a C-section. And because of having gone through the Black Birth Initiative, she had a better sense of how to advocate for herself. And also she had a better sense of how to navigate the healthcare system. And she was able to deliver a successful birth without having to have a C-section.
That's wonderful.
And that's just one example, whether it's doula support, whether it's referral services, whether it's the post-traumatic services that one might actually need. That is part of what this program has done. So you've had 6 births at the end of December, and we're having an additional 25 births by the end of this month in January. And we are only getting started.
Oh my gosh, it's music to my ears.
So with regards to the 450 startups and companies that you've helped to launch, Rosemary, again, no organization can do this in isolation. And that it really takes a partnership. And for those organizations and those listeners who are listening today that would love to learn more about this initiative, by all means, feel free to go to our website at chcimpact.org. And we would love to partner because, again, it is through partnership that we can accelerate our pace and we can close these gaps.
Okay, I think that is fantastic. I mean, it's the statistics are incredibly poor for that particular segment of the community, and I don't think that honestly most people who have babies know that, oh, there's an alternative to getting a C-section. You know, they just want to go there immediately and do that. But I applaud you on that work and that success. It's fantastic. And it's a real outcome. I mean, it's a real outcome that you can see immediately. And it's not easy to say, okay, like here's an opportunity you have, and here are the people that need it, and to connect with you. And you've done that successfully. So again, congratulations on that. And also all your other work with the World Economic Forum. I'm astounded by the progress. When I even see your bio, that's incredible. And have been done some amazing things. So I really appreciate your fantastic insights. And would you, I have like a little set of points that I want to reiterate, but I would like to ask you if there are last shiny insights you would like to share that are not covered with people who are watching, or are investors, startups, entrepreneurs, industry and in the life sciences and healthcare systems, and also in deep tech too. So that's the kinds of people that we discussed previously. But is there anything shiny that you would like to, valuable insights that you'd like to share that I didn't ask you about?
I think the key thing that first of all, I just want to say thank you, Rosemary, for your time and for this amazing conversation, and for the opportunity to be with you in this moment in time. For me, I think one of my favorite quotes is from Brian Stevenson. He's the executive director over at the Equal Justice Initiative and the author of Just Mercy. And in the book, he talks about this idea of getting close. And it's very similar for all of the different audiences that are listening to our conversation today, particularly those who are looking for ways to solve big problems. And the quote is that you cannot be an effective problem solver from a distance. There are nuances and details you will miss unless you actually get close. And the work that we're doing here at CHC in terms of engaging community, serving as a connector and a convener, being in the gaps in a way that can actually ensure that we are getting close to those who are most impacted by many of the inequities, and have the lived experiences to understand the needs and preferences, and working collectively through partnerships to be able to co-create solutions to solve for those potential challenges is something that we can collectively do together. So I would encourage your audience to visit us at chcimpact.org. Take a look at some of the programs that we're doing that is bridging sectors and industries together with a focal point of those who are particularly at the margins and bring them to the center as we create products, services, and offerings to close those gaps. This is something that is solvable, but it takes will, and it takes collaboration, and it takes innovation. And we can do this because, as you indicated earlier, Rosemary, time is the most expensive commodity that exists.
Yeah.
Once it has been exhausted, you can never get it back. We can create any other renewable product or commodity except for time. And what we're talking about here, as relates to health, is the ability to ensure that people have the precious gift of time, and that it should not be dictated solely or predominantly based off of where you live. So we have a 20-year gap in life expectancy in this country. So if you you can live in one neighborhood and have a 20-year life expectancy much higher than your neighbor 2 miles down the street. Think about that for a second. What did you do in the last 20 years? And imagine if you didn't have that. So what we're talking about here when we're creating products and we're creating solutions and we're creating services is to close that gap so that you have more time to spend with your loved one, your family member, watch your kids grow old, watch your grandkids, and the whole 9 yards, and do the things that you want to do and live your best life. And that is what we're trying to do here at CHC, one community at a time. It's not an initiative, it's a movement, and we can't do it without you.
Man, you are incredible. I wanted to just kind of recap a few things that I thought were really great. So one thing that we mentioned at the beginning was being seen. And I think that we could all work hard on making sure that we're seeing people. And then figuring out ways that if someone doesn't see you, perhaps you could make somebody aware that you're actually alive. And you said it's basically at our deepest core. It's more than condition. You're more than a condition. You're more than insurance care. You're a person sitting there, right?
That's right.
You could pinch me, and it might hurt, but I don't feel pain. So, but and then another thing you mentioned was assessing what you can learn, and you can learn a lot from people's failures and by their successes, and understanding the sense of why, and being curious to learn and continuous growing and continuous learning, which is a philosophy that you have deep in your core, clearly, and has made you very successful in your career, but also in making an impact.
Right.
You mentioned one thing that I just loved was the living history, understanding like the living history. And also, so I think about that because when I was a little kid, so my father died, I told you when I was 4. So, so the thing is, I would go to my neighbor who was in a war, and he couldn't use his legs. So the thing is, I would ask him questions, but I got to learn all these things that, who else knew those things? I mean, that's an interjection. You were mentioning there's a lot to share by people that, I mean, even people you don't know, because I walk up to people who are eating ice cream and I'll ask them what kind of ice cream, why are they eating it? I mean,
that's exactly right.
Tiny little thing, right? So, and then you ask you ask questions like, what would you have done differently? And the other lovely, I mean, there's so many wonderful stories. Is you mentioned having a conversation with someone and you listened, and the thing that I loved the most, I mean, well, I love everything the most, but I think this is something that really should be put the finger on the pulse of, is always to make sure that you're looking at things in a different way. But the thing is that like, I don't like it when people lie. Like
Yes.
that, like drives me the wrong way. But maybe I could have thought about it a different way, but I just couldn't. But I think about that when you said, here's another way to look at this particular issue.
Mhm.
But you always have to think about why you need a mentor and be respectful of their time. It's critically important. And you should show that there's action and outcome as a result of the discussion. And there's a renewed and focused component that you have employed as a result of
Mhm.
that. Um, I'm repeating myself a bit, but make sure people are seen and valued, and their living experience is valued. And we heard about what your daughter said. So always look in the eyes of the children and ask them what they think, because there's almost some great ideas. Because
But if you think about it, they're not as jaded as we might potentially be. And somewhere along the line in life, I don't know where it happens, which is why I'm a big proponent of innovation, is the fact that our imagination starts to, the ability to imagine things. Somehow, I don't know, it gets tempered down.
I
When
know,
you when
I
you
know,
talk to a child,
they don't have any. Oh,
exactly,
yeah,
right? So,
numbers.
yeah.
Doubling down is one thing, which I agree with, but I think that little bits of seeds here and there, and then and I think it's true with how you think about things, because when you build a community, it's not easy, because there's a lot of, forgive me for saying so, but there's siloed parts of a
Mhm.
community, and so the question I always ask myself is, how can I do a better job? Maybe we have to chat further about that,
I would love that.
yeah.
But
Yeah.
I think what we can do, Rosemary, if it's okay with you, I would love to have another follow-up conversation, and we can kind of dive into. I would love to learn more about the companies. You mentioned that a lot of the companies that you're working with are working on addressing many of these issues. So I would just love to figure out, how could CHC be a partner or engage
Oh,
or
absolutely. Absolutely. Yeah, we
yeah.
would love to. We would love to. Um, yeah, so we're working on, so for anyone who's listening, the Global Health Innovation Challenge Part 2, and we're inviting mentors, advisors, startups, entrepreneurs. So we start with inventions, and then
Mhm.
we marry them with talent, and then we marry that with capital. So it's like a trifecta.
Yeah.
So we invite entrepreneurs who want to make an impact on global health. And global health means basically addressing the items we've been discussing today.
Mhm. Excellent.
Health inequities, I mean, from all around the world. We're not, it's not focused on just one particular area, but of course, we've launched about 60 companies here in
Mhm.
the DMV area, but pretty much they're mostly based in Europe and the United States of America. And we would love to, and we just did a Thai demo day. So we're
Mhm.
trying to win other countries as well. But basically, we're trying to, I have this point of view. Here's opportunity. Here's
Great.
talent. They're not equally matched
They're not.
ever. So
Yeah.
the thing is, how do you leverage the talent to pick, because every year in the United States of America, we spend 140 to 160 billion dollars.
Okay.
We have about $1 trillion worth of intellectual property sitting on the shelf. We work with 153 research institutes with 170,000 inventions. Yeah, hard work and hard work and
So
grit and determination. Of course.
I love what you mentioned about innovation, talent, and capital, and that there's a lot of talent, but oftentimes the opportunities just don't align. So there's a lot. I think it said everyone's talented in some way, but opportunities not evenly distributed. So thank you for closing that gap.